Hello, everyone. Welcome to a chat with Beyond Type 2. I'm Tiara from Beyond Type 2, and today I have a special guest with me. Her name is Joy Cornthwaite, a registered dietitian manager with McGovern Medical School at UTHealth Houston. Today, we're going to be talking about insulin pumps for people with type 2 diabetes. It's a bit of a misconception that insulin pumps are only for people with type 1, but today we're going to talk about why they're beneficial for people with type 2. Also, if you want more resources on how to live your best life with type 2 diabetes, please go to beyondtype2.org. Also, remember, this information is general, so please talk to your healthcare provider before making any changes to your diabetes care. Joy, welcome. Thanks for joining me today.
Hey, of course. Thank you for having me.
I'm so glad to talk to you. You've been featured on several of our panels already through Beyond Type 1's community table. So it's just great to have you on for Beyond Type 2. And also, of course, like I already know you and you're just one of the best certified diabetes care and education specialists out there. So it's just great to have you on today.
Stop. I love being on and I really believe in what you all do and the information that you bring to people living with diabetes and then to those of us who care for them and love them. So thank you.
Thank you, Joy. So we'll just get started. Can you briefly explain what an insulin pump does?
So an insulin pump is, I like to explain to people, a mechanism of, improving the way that you care for your diabetes. And it is a device that holds insulin. And then you place it on your body, either using a tube or some of them come tubeless. And then you can program that pump to dose your insulin for you without doing multiple daily injections. So you place it, and the placement can be once every other day, once every 3 days, and then it will continuously dispense dispense insulin for you, and then you can tell it through all of the programs that are in there. You can tell it how much insulin to give you at mealtime. There's all sorts of tools and tips and tricks to adjust in micro doses the amount of insulin that you get throughout the day.
Wow, thanks for explaining that. It is, I also wear an insulin pump and it has like that microdosing effect it matters. It's such a big deal. And it kind of helps you dose more accurately than if you were on MDI. Can you talk about why an insulin pump would be beneficial for people with type 2 diabetes? And would you mind kind of going into some of the misconceptions that people with type 2 have about insulin pumps?
Mm-hmm. So a lot of times people living with type 2 don't believe, just from the very bare minimum, that they will have coverage for an insulin pump. So even beyond, thinking about, can I get on this type of therapy? The idea is I'm living with type 1 or type 2 and not type 1, and therefore I can't get coverage through my insurer to help me pay for this type of therapy. That's just the first misconception that we have to get beyond. Mm-hmm. And one of the good things to think about is, do I have a trusted care professional who I can talk to and say, I'm thinking about this. Would you help me figure out if I'm able to qualify for this? Or do you understand how to use it in my therapy? And would that be something interesting for you to go on the journey with me for? So that's step one. What usually I find is that people who live with diabetes are super resourceful. And so they are really willing to start doing the work themselves. And you can just call your insurance and see if it's something that's covered on your medical side through the insurer, or on your pharmacy benefit side through, whomever your pharmacy benefit manager is. So whatever your insurance card says as your pharmacy company is. So some of them are covered on the medical side, some of them are covered on the pharmacy, and you just have to figure out which one so that you can present it to your clinician if you're considering therapy with an insulin pump.
And can you explain the difference between the medical side, which is durable medical equipment versus pharmacy benefit?
Mhm. So on your medical side, it's your primary insurance like card, right? So the big insurance companies that you think about, the big named insurance companies, those are the ones that would cover it on the medical side. There are different amounts and deductibles, what they cover, and you would use your insurance at a durable medical equipment company, which is kind of like, like a warehouse for diabetes supplies. And they have a contract with your insurance company to provide you with pump or supplies for your healthcare at a discounted rate because they're in network together. So if it's on your medical side, you want to make sure that you know who the durable medical equipment, or shorthand DME, um, is that would fulfill your order. If it is on the pharmacy benefit side, then usually what happens is the insurers have a better relationship with the pharmacy benefits manager. So they've managed to negotiate a certain rate to provide you the pump on the pharmacy benefits manager side. So some people may have different deductibles for their medical and different deductibles for their pharmacy, and some insurance plans have those two things combined.
Mm.
So you just have to learn, shorthand. If you're taking notes right now as you're listening, you want to learn, is this something that's covered under my medical? Is it covered under my pharmacy? Do I have a separate medical deductible that has to be met in the separate benefits on the medical side? Or do I have separate benefits on my pharmacy side, and what are those?
Nice. Thank you. Thanks for breaking that down, because that kind of like insurance jargon, I think, is what trips a lot of people up, and it can be intimidating, and kind of make you feel like you don't even want to try to pursue getting other types of diabetes devices. And I'm pretty sure you've seen that in your line of work.
As
Um,
well. Yeah.
and I definitely want to touch more on the advocacy side later on, and how patients can talk to their healthcare providers with questions they should ask. But I wanted to ask you about your personal experiences with your patients. Do you what are the reactions to your type 2 patients have had to getting on an insulin pump? Like, has it made their lives easier? What benefits have they seen? Is it easier to, like, dose for meals? Do they feel more confident in eating certain things? What have you seen in your line of work?
Yeah, so it usually starts off with, as you said in the beginning, it's super personalized, right? So it starts off with kind of building a trust and building our care plan around all the things to protect and keep someone safe. So it's not usually like the very first thing we talk about when someone comes in, especially if they're a new patient, but it might be. There's a long continuum of what's happening in a person's diabetes journey. So I may have a patient who comes in that says, I've really been kind of kicking around this idea in my mind of starting on an insulin pump. And so then we start talking about that, their different options, pros and cons for each one, which type better fits into their personal goals or their lifestyle or their aesthetics. Like, what do they want this thing to do for them? What do they want it to look like? Are they concerned with battery power versus charging up and power and things like that? So there's a lot of considerations when deciding which one, but also a lot of consideration with deciding when in my journey would I like to be on an insulin pump. Now, after we do that, we actually do have in our departments, we have insurance verifiers, and we actually have a paraprofessional trained diabetes care and education support team member who can work on, and that's been something that I don't even think I told you that I'd worked on through my years here at UT. And so we finally, took the leap, and we have someone who helps our patients living with diabetes figure out the insurance journey, which is a blessing to us as clinicians and also to our patients. So we have to determine, which side will cover the pump, and then, what the payment is, or, if one is better, an option over the other. And then we start, focusing on the education as we're working on getting it shipped. We start working on how we shift your current MDIs or your multiple daily injections, what a shift from an MDI plan to the pump will look like. So we have preparation, and everyone's assigned their diabetes care education specialists here, and you stay with a person. So there's a continuity of care here. But you get someone used to how the manual injections will be taken to automatic using pump therapy. And a lot of times, all of the questions that you have as someone living with diabetes on multiple daily injections can be addressed through pump therapy. So, some of the times my patients will say, well, I wish I didn't have to feed my insulin, right? So I wish after I do an injection, I don't really feel like eating, but I know I'm going to be low. So then I eat, even though I'm not really hungry. And then you're like, okay, well, so you take one type of insulin in an insulin pump, and you can assign your basal therapy and then adjust it up or down or extend a bolus, and all of these things that you're already doing in your mind as someone's living with diabetes get automated. And that's the beauty of someone transitioning from MDIs to a pump.
And that transition, the burden, the mental burden is like lifted. And I just want to clarify a couple of terms for people who are new to insulin pumps. Joy mentioned the term basal. Your basal rate, that is just like the steady dose of insulin that you're getting throughout the day. If you're on MDI, you're probably taking something like a long-acting insulin for your basal insulin. When you're on an insulin pump, you take one type of insulin, and that serves as both your bolus, which is for mealtime insulin, and your basal, which is that steady flow of insulin that you get throughout the day. And Joy, you also mentioned another term here, which is extended bolus. And I think that's like one of the best features of using insulin pump. Can you talk about what an extended bolus is and why it's awesome?
Yeah, so I'm sorry, y'all, I'm throwing out all this jargon. It just makes me really excited to talk about insulin pump therapy, because like you said, the burden of like thinking through all of that, and we know that there's diabetes distress. You've got to check your blood glucose values. You have to record them. You have to make decisions around them. You have to think about, am I exercising? I mean, there's just question after question after question that comes rapid fire in your mind when you're doing this. So a pump is really great because as you program it, you've programmed these answers to these questions, and then you're having it apply. So you have to make a few less decisions, still decisions, but a few less. So the extended bolus feature, as you were mentioning before, is one of my patients' absolute favorites, I think. So imagine that you are eating something that processes to glucose very quickly, right? So you've taken a food item and it's a little bit higher glycemic index, or transitions from the food in your mouth to causing your blood glucose values to rise faster. Well, you can extend the bolus. So you would tell the pump that you're taking a certain amount of carbohydrates, and then you would ask it to dispense your insulin over time. And so if the peak of your glucose is going to happen quickly, you would ask it to dispense the insulin all at the same time. Okay, so more upfront, a little bit less behind. So what the extended bolus is actually doing, it's matching the same amount of insulin that you've taken. So the peak of the insulin that you've taken, it's taking it and it's shifting it to match the peak of the food. So if you eat something that's maybe a little bit more high fat, like say pizza with like cheese on it, right? And so that's going to delay your stomach emptying a little bit. And so most people will see a rise in blood glucose after something high fat, like 3 or 4 hours after.
Yep.
So you can still give yourself the bolus, right? But instead of with an MDI, when you inject and all of your insulin is received right now, what you can tell the machine is I've eaten this amount of carbs and I want just 10% of my insulin up front. And the remainder of the insulin that I give you now, you're going to dispense later on when my values are elevated. So now you've taken the peak of the insulin and moved it from forward to back to match the food, which is going to rise later. So I like to call it, where generally we're giving insulin, you're making your insulin needs congruent with your glucose needs. And so that, I think, gives people a sense of a lifting of the stigmas around diabetes, which are like, well, I shouldn't eat this, I shouldn't eat that. Right. Most of us know what healthy items are. Yeah. And sometimes we choose the things that are less optimal, right? And if we do that, when we're not living with diabetes, our body just compensates. It fixes it for us. But when we're living with diabetes, we're like, well, just don't eat it because it'll be easier.
Yes.
But with a pump, you can choose your activities, you can choose your meal planning, and you can help shift the insulin so that it matches with what's happening in your body.
Yes, that is an excellent explanation of extended bolus. And it kind of like what you said, just when you're on MDI and let's say you're taking fast acting mealtime insulin, you're pretty much giving everything up front. And depending on how much insulin you're typically using, like, so I'll use myself as an example. Whenever I'm taking like a pump break or something and I go back on MDI, I actually give myself more insulin than I would actually use compared to a pump because I don't have that extended bolus feature. So I'm like kind of giving myself a little bit more just because I'm like, I don't want to eat this pizza. I'd rather give myself more insulin just to compensate for it 3 or 4 hours from now. But if I have that insulin pump, I'm not taking as much insulin because I'm telling my pump to give me like 50 or 60% of that bolus later on just to compensate for that.
Exactly.
Absolutely.
Yeah, exactly. And it's just really nice to have that level of control.
Yes.
Over your own, your own decisions. It's not something that's like, you have to think that I'm feeling guilty, I'm doing something wrong.
Right.
If you're exercising and you need to, and your glucose values rise related to the exercise, you can extend a bolus, or you can like do another term here, a temporary basal change. So you can adjust the amount of insulin that you need.
Yes. And that also accounts for things like sleep. So you mentioned like going low earlier, and there's research that says that being on insulin pump is actually beneficial for people who are at risk for hypoglycemia because you can make those changes. So if you're someone that is typically going low at night and you're on MDI, you can tell your pump, hey, probably don't give me as much insulin right now. And you can actually tell it to start giving you your regular basal or steady dose of insulin maybe as you wake up. Because if you're a little higher when you wake up, you can say, this is the time to start kicking it back in. And therefore you can go to sleep and you can actually sleep a little bit better because your insulin pump is taking care of all of that.
Yeah. And I like that you mentioned about the basal rate changes. So the nice thing about it is because when you give yourself a single dose of insulin using a syringe or a pen, you're giving yourself a single dose, and then the insulin starts working and it just stays working. With the settings, you can actually change the settings throughout the day. Yep. So you could have a certain steady dose of insulin from 8 to 10 o'clock in the morning, and then change it from 10 o'clock to 3, and then change it again from 3 to 5. Like, you can change it when you need it. When you need a little bit more, you change it, you need a little bit more. When you need a little bit less, you decrease it so that you're not getting as much. So it is very common that people who are on insulin pumps will take a smaller amount of insulin while they're on pump therapy than when they're on multiple daily injections.
Absolutely. And I want to also get into some of the, I guess, if the burdens of wearing an insulin pump. What burdens have your patients expressed, and how do you handle them? So, like, one of the ones I've heard a lot is just having something attached to you that reminds you that you have diabetes every day. Like, what have you heard that, and what are some others that you've heard, and how have you eased those concerns from your patients?
Yeah, so there are, everything that we do in life, every decision that we make, we want to make sure that we make with all of the information, right? So a lot of the times, the burdens and the fears, we have to allow people living with diabetes to decide which ones of those burdens or which ones of those cons are something they would live with for the benefit of the pros, right? So I have, again, people all on all continuums of diabetes care, as well as, their diabetes journey. So you may have someone who is very new to MDIs and someone who's been on MDIs for a very, very long time, and they've lived with diabetes for many, many years. And that person's experience and understanding about pump therapy is going to be a little bit different because of their experience with, like, maybe tweaking their own care with their physicians is far greater than someone who just started, right? So we kind of take a look at all of the benefits that someone wants from a pump, and then which pump will provide those benefits. And then look at the other pumps and see, which are the burdens that are too great, that you feel are way too great for you. So some people may say, like, I can't be tubed. I don't want to be tubed. That will give me a greater reminder of, like, my condition and cause me to stress a little bit more if I'm tubed in some way.
Yeah.
And so then we say, well, this is the pump option for you.
Yeah.
Some people will say that they want an integrated pump. So a pump that's fully integrated with a CGM. And then you start from that point and say, okay, these are the pros of a pump that's fully integrated. And while this one is not fully integrated with a CGM, you may be able to use certain applications to be able to see them together. Yeah. And so a lot of times I just take the individual questions, and then knowing my patients, like, so intimately, and having gained their trust, I can kind of help guide them to what are going to be the best options for them. And then, address and acknowledge the fear, and then talk about how you can moderate, the burden around those things. And so sometimes we end with, at the end of the day, yes, I want an insulin pump, and I know it's going to be this one.
Yeah.
And sometimes, like, I'm not quite ready yet.
Yeah.
Can we, address this in 1 month?
Yeah.
And I'm with my patients, whichever journey they feel like, because I think one of the most important points about transitioning to pump therapy is being ready to transition to pump therapy.
Yeah.
Because it'll be a learning curve.
Yeah.
So there are, in addition to that's going to be visible, I'm going to have to explain that to people. A lot of people don't know about my diabetes, and I prefer to keep it that way. There are certain pumps and pump management systems that are kind of like undercover. They look like everything else.
Yeah.
So and you can hide them a little bit more placement wise. There are all sorts of things. And I know that it sounds super general when I say this, but really, whatever I have to do to shape care to an individual person is what we're going to do.
Yeah.
You know, I never see my patients as the same
Right.
at all. I have no expectations
Right.
of the patient that I saw this morning being exactly like the patient I saw this afternoon. And so we just go on the journey together and figure it out.
Yes. Yes. And this is everyone, don't y'all see why Joy is like an amazing CDCES? I mean, just and y'all, this is her like all the time. So Joy, just fantastic breakdown on like addressing those burdens and the fears that people have, and just reiterating that there are pros and cons to everything. You have to figure out which con is going to be worth it if you get the benefits.
Yeah.
That's a really great mindset to have for anything, not just diabetes care. And you did mention a couple of terms that I want to kind of expand on a little bit. Could you talk about what you mean by integrated and partially integrated for CGMs and pumps?
Okay, so you have, again, me with these words. There are some continuous glucose monitors that will actually communicate with your insulin pump, so that there's programming or like math logic that tells it if your numbers are decreasing so fast or at a certain speed, then the pump will suspend for you in order to protect against a low.
Yeah.
For a person who is very sensitive to insulin therapy adjustments, meaning that they may have low blood sugars or hypoglycemia very, very frequently, that might be a pro that is worth the con of, is this pump more visible?
Yeah.
Okay. So if we have a conversation, if another pump does not directly speak to the CGM, so as it's reading it, and someone is maybe like doing finger sticks instead, if they feel comfortable enough recognizing symptoms of a low blood sugar, and then they can suspend their pump on their own for a short period of time, that might be more, it still allows them to protect against the low, right? But it's a less visible device. And so they may choose the less visible device if they have to manually manage their low blood sugars. So, and that's something for everyone to kind of, consider, because I think too, sometimes clinicians are like, why wouldn't you want a pump that speaks directly? And it's like, because they don't want it to be seen.
Yeah.
It's, they're willing to take this con over this pro because they feel comfortable in managing their care. And so, as the diabetes care and education specialist, and maybe a little bit more in tune with the difference between each pump type, that's where we step in and we're like the bridge. We have to translate the fears and the burdens and the wants and the not wants into something that both sides understand.
Yes, absolutely. Oh, wow, Joy, that's such great information. And I kind of going back to the advocacy piece, and I think this is like my last set of questions for you. What are some questions people with type 2 diabetes should be asking their healthcare providers, whether they see a diabetes care and education specialist or primary care provider? What questions can they ask to help them advocate to get an insulin pump? Because one of the things that we've seen a lot in our community is, well, I can't get an insulin pump because I'm assuming it's not going to be covered, which is something you talked about earlier. But what are some questions that they should be asking their healthcare providers to get them to advocate for them?
So one of the things is making sure that there's an infrastructure for you at that clinic, through, because of resource management, because of staffing, because of specialization in certain clinics. there may not be someone who understands how to upload a pump or get reports to a pump, or the staff there may not be able to interpret
Yeah.
the reports to adjust your changes. So that should be like, one of the first things that you talk about. You can kind of do your own research, see if your pump it would be covered and how, right? Or you can ask someone at the clinic if they know how to find out if a pump is covered for you.
Yeah.
So that's like the insurance part. That's step one. Then step two is going to be, will you know what to do with this pump if I get one? Will you be on this journey with me, right? And if they say no, that is also not a reason to say no, right? You may really love your clinician and you want to stay with them. You can ask them, do you partner with anyone who would be able to assist me? Maybe they have a specialist that can upload the reports, or has someone, because there are plenty of clinicians who have partners who are aware within the same institution or within the same clinic. So they may not be able to do it directly, but they may be able to utilize the staff from one of their colleagues to help you. So don't always take no as an answer. Kind of say, okay, no, but what if?
Right.
No, but what if? I think it's like a journey of diabetes. It's always like there may be a negative answer, but you're like, but what if I did this?
Yeah.
And then
usually keeps your mind open too. It keeps your mind open to the next possibility instead of like you hear no, like if your primary care physician who doesn't really know about insulin pumps and they're like, I don't know how to upload it or help you with it. I can't be on this journey like you need me to. Instead of saying like, well, I guess I'm not going to get the care that I need. You can just say, well, who can you point me to who does?
Exactly. And would you be willing to partner with them? So, because we have a lot of, I mostly see patients who live with diabetes and like on a whole spectrum. So I have a lot of pump patients, a lot of MDI patients. And I do have some who are consulting into our clinics. So they may have a primary physician who takes care of their everyday care. And their primary physician says, well, I know these great doctors over here at UTHealth who do pumps. I'm going to give you a referral to them, do what you do with them, and then we can co-manage together. And so that's something that's very routine. If you live in an area that's a bit more rural, you may have to go specifically to an endocrine specialist to get that level of care, or even to like the next, not everybody's urban like we are. But you may have to go like to the next big city to get that care. But the nice thing about, even if you have to do a consultant in like a little bit further away, a lot of care is done remotely.
That's right.
In terms of managing reports, because they're in the cloud, they're in HIPAA compliant portals, and you could do a telemedicine visit or a telehealth visit to review your reports and then go in intermittently to see that person.
Absolutely. And I love that you brought up the reports, because that is another great thing about having like these devices, is that it has like how much insulin that you're using per day. And that helps you just even understand like how much insulin you should be using for meals. So a lot of people kind of guess like how much insulin they should be taking per amount of carbs. Those reports will help you figure out your insulin to carb ratios, your correction factors, which is how much insulin you need to bring you down a certain amount of points. You get so much information, and that information even helps your provider understand your diabetes as well, so that way they can help you.
Yeah. And one of the things that I do often, like every single time that I have a visit that includes a pump, is to talk about the reports with someone. So ask someone who knows how to read your report what your report says, and we'll have whole sessions around, this is why these changes should happen based on your reports. Look at your graph. This is what's happening here. perhaps if we change the, the steady insulin dose between this hour and this hour, you'll get more coverage. And so ask someone who is taking care of you to talk to you using your reports. That's powerful information.
Yes, absolutely. Joy, this is such a great interview. And that's all I have for today. But I definitely want to talk to you again about devices and type 2 diabetes. And I just want to say thank you for just breaking down why type 2 people with type 2 diabetes can benefit from insulin pumps. That it's not just for people with type 1. It seems like the question, can I get one? It really depends on insurance, but you broke down DME versus pharmacy benefit coverage. And I think another important thing that you really hammered on, which is not taking no for an answer, and help in getting your healthcare providers to kind of be on your side or help you find someone who can go on this insulin pump journey with you. And for our audience, we also talked about the benefits of things like extended boluses, which can help you be more confident in the things that you're eating. And Joy, you brought up just beautifully earlier how that really goes against the stigmas around, can I eat that with diabetes, especially with type 2 diabetes. Joy, do you have any other final thoughts for the benefits of insulin pumps for people with type 2?
No, I'm really, heartened and sort of re-energized by this movement that Beyond is doing now about informing people about insulin pumps. Earlier in my days, I won't say how long ago, but earlier in my days when I'm people who want to use insulin pumps should be able to use insulin pumps. This is how we do it. This is how we train someone to use an insulin pump. It should augment your care. It shouldn't, all of the things that people do day to day, when you automate it, it's amazing. We could ride bikes all over and we could crank our cars and pedal them Fred Flintstone, but we've mechanized all that now.
Right.
So, so some people want to have an old vehicle and a classic car. And some people want MDIs. Let people who want MDIs live, and care for themselves with MDIs, but offer pumps just in case.
Yeah.
And if someone wants a pump and wants to progress or move from an MDI to a pump, allow them to move there too. So, I guess my other point is just allow people to discover what it is about therapy, that using an insulin pump, that would make their lives better.
Yes.
And then help advocate for them to get there if that's what it will take.
And also if you, just because you're newly diagnosed does not mean that you shouldn't get that information as well. At least you should be presented with all the options up front, even if you were just diagnosed with type 2 diabetes yesterday, because having those options it stimulates curiosity and knowledge that you can search for and learn which method is going to be best for you in the long run. And some people are really afraid of needles. But an insulin pump can help them with that. If they're just you want me to take insulin, I don't like needles. So I can tell you, me jabbing myself multiple times a day for meals or even just for long acting, that ain't gonna work.
Yeah. And like you said, every visit, for clinicians hearing as well as patients hearing, every visit, different options of diabetes care should be offered.
Yes.
To you, because even if you say no today, maybe you say yes tomorrow or next year.
Yep. Well, Joy, thank you so much. I will make sure to put in some links, everyone, for Joy's other appearances, the Beyond Type 1 and Beyond Type 2. She is a fantastic panelist. Just great for people with diabetes. So it's just a wealth of knowledge. So Joy, just always great to have you join us for an event or for a conversation. Everyone, please check out our resources on insulin pumps for people with type 2 diabetes. That will also be in the description box below. Remember, this is general information, so please talk to your healthcare provider about insulin pumps for your specific situation with diabetes. And we're rooting for you if you're someone that wants to get one, or if you found this information helpful. Please also let us know. You can email us at hello@beyondtype2.org, or you can send us a message on social media. And if you're looking for other resources on how to live your best life with type 2 diabetes in general, please go to beyondtype2.org, and we will see you next time.
Thank you.